My name is Thomas Azeke. I am a student of Health and Social Care at Stafford University. I'll be presenting analysis, analyzing strength and limitation of visual communication in health and social care. Outline introduction as stated below. Introduction. Visual communication refers to the use of image and symbol, diagram, colors, and other visual elements to convey meaning in health and social care. It plays a crucial role in supporting understanding, especially when verbal communication alone is insufficient. This presentation examines strengths and limitations of visual communication and explore how it applies in health and social care settings. It also allows situations where visual communication is particularly effective and challenging and offer strategies for improving its use to enhance personal-centered care. What is communication? What is visual communication? Visual communication involves transmitting information through visual cues such as pictures, chart, gestures, colors, coding, written symbols. It supports comprehensive by presenting information in structured and easily recognizable formats. This makes it especially useful in environment where clarity and speed of understanding are essentials. In intersocial care, verbal communication is often used to complement verbal explanations, help service users interpret information more accurately. It is particularly valuable for individuals with language barriers, cognitive impairment, or limited literacy, as it reduces reliance on complex verbal processing. Key features of visual communication. Key features of visual communication includes diagrams, photograph, icon colored coded system, and written prompts. These elements help break down information into manageable parts, making it easy for service users to follow instruction and understand procedures. Non-verbal, visual cues, such as body language and facial expressions, also contribute to communications. These cues help convey emotions, attitude, and reassurance, such as essential therapeutic interaction when combined with visual communication. Visual elements create a more holistic and effective communication approach. Key features. Key features of communication. Key features of communications include diagrams, photograph, icon, colored, coded system, written prompts for elements, helps break down information into meaningful parts, making it easy for service users to follow instructions or understand procedures. Non-verbal communication cues as well, as a body of body language and facial expressions also contributes to communications. Strength of visual communication. One major strength of visual communication is the ability to simplify complex information, diagram, charts, and images, which can make medical procedures, treatment plans, or risk assessment easy to understand. Visual communication also improve retention and recall. Research shows that individuals remember visual information more effectively than spoken words alone. Straight in care settings. In healthcare settings, visual tools such as Paint, scale, picture boards, and signage enhance accessibility for individuals with communication difficulties. These tools support independence by enabling service users to express needs without relying solely on speech. Visual communication also support accurate assessment. Tools like body maps, symptoms, charts, and visual consents. Aids help practitioners gather clearly information, reducing the risk of misinterpretation. Limitations of visual communication. Despite the strength, visual communication has limitations. Visuals may oversimplify complex informations, leading to misunderstanding if not accompanied by clear explanations. And visual communication can also be ineffective for individuals with visual impairments or certain neurological conditions. In such cases, relying heavily on visual tools may exclude service users or reduce the ability to participate fully in decision making. Challenging in health and social care. A key challenge in health and social care is ensuring that visual materials are accessible and appropriate for diverse population. Poorly designed diagrams, unclear symbol, or cultural unfamiliar image can reduce understanding and create confusion. Another challenge is the risk of inconsistency. Use of visual tools are not used systematically across teams. Service users may receive missed messages. This inconsistency can undermine trust and reduce the effectiveness of communication strategies. Visual communication, when visual communication is effective, visual communication is highly effective in fast-paced environments such as emergency care, when quick interpretation of information is essential. Color-coded charts, signage, and visual triangles tools help practitioners to make rapid decisions and guide service users safely. It's also it's also effective in dementia care, mental health settings, and individuals who struggle with verbal expressions. Visual prompts, pictures, schedules, and emotions chart help reduce anxiety, support emotional regulation, contributing to more positive interaction. Improving visual communication. Improving visual communication can requires using clear, cultural, appropriate, and accessible materials. Practitioners should all ensure that images are simple, relevant, and supported by verbal explanations to avoid misinterpretation. Consistent color coding and layouts also enhance clarity. Practitioners should check, understand, regular, and adapt materials for diverse needs, such as providing large print versions or title resources for visual impairment, individual training, and reflective practice. In conclusion, visual communication is a powerful tool that enhances clarity, accessibility, and personal-centered care when used effectively in supports. Understanding, improve recall, and enable service users to participate more fully in their care. However, visual communication must be used thoughtfully to avoid misinterpretation or explanation combination. Visual combining visual, verbal, and written communication ensures safe, inclusive, and effective practice. Practitioner who adopts visual tools to individual needs contribute to high quality for equitable care in the NHS.